Hey everyone, my name is Dr. Jonathan Chu, and I'm one of the interventional pain specialists here at WellSpan Health. Today I want to take some time and just talk about two of the most common causes of low back pain and some of the easy treatments that we have available here at Interventional Pain Management to help ease your pain without having to rely on pain medications. So the first condition that I want to talk about is actually the most common cause of low back pain, and this is called sciatica. This is when the small holes surrounding the nerves that exit the spine narrow over time. This results often in pain that radiates all the way from the low back down the leg. Now, the most common treatment that we use in interventional pain management for this condition is called an epidural injection. This is when we use X-ray guidance to guide a small needle into the epidural space. This is the space that surrounds the spinal nerves. Once we have the needle in that location, we inject a small amount of steroid medication that acts as a very potent anti-inflammatory that helps to ease the pain and calm the inflammation for, on average, about 3 months. The goal of this injection is to provide you with a nice window of pain relief. During this time, you have the opportunity to work with physical therapy and to develop a long-term home exercise program. By rebuilding your strength and mobility, the goal is to reduce and hopefully prevent future flare-ups afterwards. The next condition I want to talk about is something called lumbar facet pain or lumbar facet syndrome. This is actually the second most common cause of low back pain. Throughout the spine, there are these small knuckle-like joints. These joints are called the facet joints. Just like your knees, hips, or knuckles, they can develop painful arthritis. For this condition, there's actually a very nice two-step procedure that we have available. The first step is a diagnostic test called a medial branch block. With this procedure, we guide a small needle onto the small nerve that supplies these facet joints and numb them up. Now, this test is only designed to last for 1 day. However, if your pain is improved for the rest of the day after this procedure, then we've confirmed our diagnosis of the facet joint pain. If your medial branch block is successful and your pain is relieved by it, then we can move on to the next procedure, the long-term procedure, which is known as a radiofrequency ablation. With this procedure, we guide a special needle over the medial branch nerves. The tip of this needle then heats up a little bit and makes a small burn over top of those nerves and numbs up those joints for about 9 months at a time and works very, very nicely for facet joint pain. Thank you so much for taking the time and watching. We're looking forward to seeing you in our clinic.